cultural program, which will follow our program here. She's a comedian and a performer, actress, writer. Please give a warm welcome to Maysoon Zayed.
Hi, everybody. Salam, salam. Give it up for our MC all day who has done a great job, Ali. Thank you. Hi, everybody. My name is Maysoon Zayed, and I'm here to encourage you all to come to the cultural night tonight. We're going to have live music, we're going to have a Debka lesson, and most importantly, you get to listen to me. I am coming to do stand-up comedy tonight. Now, why are we doing comedy in the middle of a genocide? Because Mustafa, you're here. Hi. He and I did revolutionary things 20 years ago. Oh my gosh. Sorry, that was weird and shocking. I'll come back. The reason that we're doing comedy is threefold. One, full families are being wiped off the registry right now. The oral history of Palestine is more crucial than ever. So tonight I'm going to take an opportunity to tell you all about my Palestinian family, going 8 generations back to remind the world that we do exist. Laughter is healing. Existence is resistance. And we ask you tonight to come to the cultural evening because with everything that's being erased, our culture is thriving. Our culture is healing, and our culture is an integral part of the Health Initiative. So I hope you'll all join us tonight and enjoy the rest of the conference, inshallah. Bye. All right, I'm gonna jump into the audience while screaming jihad. Ready? 1.
Please give it up for Maysoon one more time. Thanks, Maysoon, and I'd like to draw your attention to the QR code. If you haven't gotten a ticket yet, please scan the QR code and acquire your ticket online. There is a promo code for all of you present here in the conference. Actually, the promo code is conference. That's an easy one. Just so you know, the money obviously will be donated to the people of Gaza, and I'll make sure to get the details later. Maybe I can share them with you. So let's please leave this on and do not show the next slide until about 5 minutes from now. Meanwhile, I will invite the speakers of our next session to come forward. They will report from the workshops, and this session is the reporting out, clarifying priorities now and in the future. Can I please ask the speakers to come forward and take their seats? So these are the reporters from the workshops. Rehab, Mohammed, Dr. Fauzi. However you please. So thank you very much. You will be reporting on behalf of your workshop. The format of the session will be as follows. I'll have a short conversation with each of the reporters, and I thank them in advance for their patience with my time management, in the interest of ensuring that all of you actually get a chance to speak roughly equally. And subsequently, we'll open up the floor for interaction, and you can ask your questions and make some comments. I would like to start with Rehab Sanduqa, who is a public health expert. And she's with Judur, and she did the workshop on expansion of basic service delivery with a focus on maternal health and mental health. Please give Rehab a welcome. So Rehab, about 500 women deliver in Gaza every day. How should they be supported? Yes, there's a microphone.
We have now more than 60,000.
Get it closer, yes.
60,000 women, pregnant women now in Gaza. And we expect 5,000 women to give birth every month. 150 to 180 women delivered every day. So the immediate action to support all these women and the maternal care for these women is to continue and expanding the mobile clinics, the medical points in shelters, to support these medical points with what they need from delivery kits, medications, and with also a well-trained health team to at least to save lives, and as well as maybe we need to take care of the what we call emergency transportation for the at-risk cases, to if there is a high-risk woman, to transfer them to secondary or tertiary care. Of course, we have to.
So this is the integrated referral mechanism you're talking about.
Again.
The referral of patients.
Yes. And this is what I mean by referral. Maybe it should be more developed in transitional recovery, because we need to have a kind of referral network between primary, secondary, and tertiary care, and also in order to unify the interventions with these cases.
I believe you also touched on the need for a medical supplies corridor.
It's the must, and it should be facilitated to have all these medical supplies and assistive.
How can we realistically realize such a corridor under current conditions?
We need lobbying and advocacy in that issue. We need to put pressure, and this is an opportunity actually to ask everybody here to use the power that we have and to put pressure and for advocacy to facilitate these humanitarian aid.
Right. You also touched on mental health in your workshop. As an outsider, I might ask, is there time for mental health under the bombardment?
It's the most essential things, actually. Everybody is traumatized in Gaza. And we believe that maybe it's not the time for specialized services, but at least we have to integrate all the mental health and psychosocial support within the health and services, I mean, within the medical points in shelters.
You have counselors, yes?
Yes, and they can support them. We have also community health workers who are spread inside these shelters. They can form support groups. They can, non-specialized person who can help. Of course, there is a need to refer cases for more sophisticated and specialized services, but if it's available. And we hope that in the transitional phase we can do that.
Thank you very much for selecting the key points from your workshop. I'd like to move on to the workshop supporting the health workforce during crisis. I'm sure you've noticed that the first three workshops are about the immediate needs and the emergency response, and then the second half will be the long-term reconstruction. We have with us public health expert and lecturer at Oxford and Canadian University, Dubai, Mohammed Al-Khalidi, sitting right here. Please give him an applause. The first person. Wow. I feel someone is intervening. I will not say who. Is this still okay? Is it okay? Do you want me to switch the mic? Sound engineer? That's fine. Okay, I'll actually take a different mic. Check, check, sound check. All right. So Mohammed, like everyone else, medical professionals have their basic needs. How do we address those?
Yeah, actually, first we need to start, assessing the actual needs and the priorities of the workforce in the current situation, and trying to support their, coping mechanisms, as well as designing some action and urgent interventions to satisfy their family and also the health workforce related needs, such as financial support, incentives. And when it comes to the technical professional related issues, so we need to actually support them with the needed skills and knowledge by supplying more international medical teams, and we can launch a call for inviting the Palestinians from Gaza, Palestinians who are actually involved in the healthcare systems before the crisis and also during the crisis, to come back to contribute to the overburdened workforce. So we can actually amplify and double their efforts, and we can help together with the locals and international medical teams and the staff. So this is an important and urgent action that we can actually
So bring in
start
teams
by.
that can relieve the ones
Exactly,
that are working
international
now.
teams supported by the Palestinians who actually left.
And you'll make
Gaza.
sure they learn from the experience that the Palestinian teams had before.
Absolutely, yeah.
How have you talked about how you can make this happen?
I think we can, this is an entry point to collaborate in by launching a call and, sorting out the list of expertise around the world, especially the Palestinians who are, most of them are ready to come back to Gaza to contribute. Because you can't rely on the current, workforce that they are working in the healthcare system, which is already collapsed, and they already overburdened and over, loaded with the huge experiences and work. So we can have that and urgent actions to be, to be supporting the health system from the workforce.
Have you discussed in your group the practical steps that you need to take towards realizing this?
I think the NGO and the international actors, such as the WHO, maybe international medical associations, can contribute. Regional actors, such as the Arab communities or Arab organizations, can work together in order to make this happen on the ground.
My last question, Mohammed, of course we are seeing fresh students, medical students, who are already on the front line delivering care. Their education is not complete. Have you talked about education and medical training under these circumstances?
Yeah, we have covered this important issue in order to fill the gaps in the severe shortages in the existing workforce by bringing the fresh graduates and also the students who already joined or enrolled in the medicines, faculty of medicines or nurses or physiotherapists, etc. And we can solve this urgently by providing a collective or global consolidative education and the training program.
And this will need to be delivered digitally, perhaps?
Digitally, of course. And this is an urgent action also, because we need to fill the gap of knowledge, skills, and the competencies needed now, because many workforce are experiencing unexpected cases or unprecedented situations, especially in the emergencies.
You'll see later that your neighbor is actually already working on a similar idea. Little cliffhanger. Thank you very much, Mohammed. I'd like to move on to Dr. Fawzi Al-Hammouri. He is the executive chairman of the Gaza Health Initiative, but he's also the general director at the Specialty Hospital of Jordan. Thanks for being with us. Please receive your applause. Dr. Fawzi, you talked about delivering commodities and supplies. What is the status in Gaza?
Well, thank you very much, Ali. Before I speak, I have to acknowledge that we have in this session 4 distinguished speakers. We have Sandra Rashid from ANERA, we have Adib Shweki from Rahma, and we have Dr. Marwan Hinnawi from JECO, and we have Dr. Uthman Asmadi from Hashemite University. So this, what I'm saying now, is what we agreed upon in our session also with the audience. We have analyzed the status of essential medical list in Gaza and essential medical supplies. And to our surprise, you will notice that there is a big gap between the north and the south. So if you look at the medicine in the north, zero stock of essential medicine reach out to 55% in the north, while it reached 70% in the south.
So 55% and 70% respectively of essential stock?
Yes, between the north and the south.
Present.
And while for the essential medical supplies, the figures is more scary. 66% in the north and 89% in the south. So you could imagine how could a healthcare worker or a physician or a nurse could practice without medicine, without medical supplies.
And that is because of the infamous dual purpose list.
Well, actually, there are so many reasons why there is shortage of medicine and medical supplies. First of all, the borders are very restricted. Anything has to go to Gaza, has to go through certain procedures. Approvals takes a lot of time. And there is something they call dual use. I'm sure you know what we mean by dual use. So I cannot understand how medicine or medical supply can be of dual use. And unfortunately, this dual use list is being updated and being expanded. So, I mean, today, like, it includes 500 items. Tomorrow, it will be 600 items.
It's used as a
so
means
that
of
makes it
war.
even more difficult. So our colleagues, they say that when they send a container of medicine, while it is on the bridge, they call them, come and remove that item. So you can imagine how you have to open that truck and you reach out to that medicine and you remove it and put it back. This is very difficult job to do. Again, the other thing that why the north is different than the south, because there is like a border between the north and the south now, and you cannot send any medical supply or medicine from the north or the south.
But you've also talked about a very concrete initiative that you want to take regarding supplies.
Well, yes, actually, because we know there is a restriction on sending the medical supplies, we thought that we should have an interactive platform. In this platform, the people on the ground in Gaza, they will put what they have in stock, what is their needs, and prioritize their needs. So if I am a donor or an organization and I want to send certain medicine, I will send the medicine that they do not have, and it is priority. So that's something. The other thing that the audience, they were very much interested to know who are the local partners. So if I can send medical supply truck and it goes to Karam Abu Salem border, who will receive it at the border and send it to the warehouses in Gaza or to the Ministry of Health or to the hospitals? So you need somebody there inside Gaza to be able to transmit this medication or medical supplies to those who need it. And also we have noticed that there is looters inside Gaza now, because you know there is no security, and these looters, you have to have protection to protect your shipment to be able to send it to those who need it.
Thank you very much, and I'm very happy to hear such a concrete proposal. Now let's move to the second half, which is about reconstruction and recovery of the health system. Revitalizing and rebuilding the health information system is one of the workshops, and I have sitting next to me the head of health communication at UNRWA headquarters, Amal Arafa. Please welcome her. Amal, Gaza before the 7th of October had quite a robust health information system. Am I right?
Yes, absolutely, you are right. Before 7th of October, and despite the siege that Gaza had and the situation they have, the workforce in Gaza, they knew what they are doing, and they know what they are doing now, and they know what they need in the future. So they had a good system, but the problem now is with the infrastructure, the electricity, internet connectivity, and so on. So whenever these, resources are available, the system can be easily rebuilt on and reactivated and worked on.
So actors who go to Gaza to deliver aid, hopefully after a ceasefire, they do not need to reinvent the wheel, but you're inviting them to build on what was there already.
Yeah, we don't need to start from scratch. We have a good system in Gaza, and actually it should be nationally owned, because as I said, people who were there, the workforce, the organizations who were before 7th of October, who were really active before 7th of October, they are capable of move on and support the system after ceasefire.
And they are well rooted in the community.
Yeah.
Excellent. Now, when we talk about health information, obviously the primary reason is health delivery. but there's other purposes that health information and data can be used for.
Yeah, of course. Actually, there are like priority indicators that we need to work on at the beginning. And they are very important, you know, for advocacy.
Right.
And for sure for accountability.
That is when someone hopefully is brought to the
Yes,
courts.
because transparency is very important and accountability is important. And the indicators that we need to, let's say, work on at the short-term stage is maternal health, child health, the services available or the facilities of health services, and of course the outbreak of infectious diseases. These are top priorities at the beginning. Then after the long term, we can say the mental health issues, because you know mental health is very important, and within the current situation, the percentages is rising. And of course, it should be also focusing on physical trauma, and to focus also on elderly people. The services for health services for elderly people also on the long term is very important.
And this is data that requires long-term monitoring.
Yes.
Thank you very much. Moving to the workshop on strengthening the workforce and the medical education system. We have with us Professor Mahmoud Lubani of Palmed Academy. Thank you for joining us. Please welcome him. What is the main challenge you've discussed, Professor, in your group?
So the two main challenges were, the first one is there was no medical graduates this year from Gaza, despite the numbers of senior doctors and junior doctors and other health professionals being killed, injured, and imprisoned by the Israeli occupation forces. That's one challenge. So there is no renewal of the workforce. The second challenge is the danger of that the medical schools and in general the universities in Gaza may not survive this ecocide, and that will cause a big problem for the future of Gaza.
And you've discussed a very concrete initiative in response.
Yeah, so we've been leading on this Gaza Educate Medics scheme, which is to provide medical education for all the medical students of Gaza in collaboration with the deans of Al-Azhar and the Islamic universities.
So it's called Gaza Educate
Medics,
GEM for short.
Yeah.
And it was
GEM
launched in? When was it launched?
So we launched it on the 1st of June, and from that date, students have been able to register, log on to the platform, and access all their educational material. They have a portfolio on the platform where they can upload their evidence of completion of their competencies, and also they are receiving now structured live interactive lectures by international volunteers, faculty who have volunteered to teach them on this scheme, as well as we've engaged a lot of the local faculty that were there already that we have been able to access.
How many students have registered?
So we have 2,101 students registered on the scheme with us, and we're providing medical education for them. 80% of them are still in Gaza, 20% had been displaced. The ones in Gaza started their clinical placements on the 1st of June, on the day of launch, and the students of Al-Azhar and the Islamic universities, they attend clinical placements 3 days a week, alternate between the two universities because of the scarcity of the clinical placements in Gaza, but they're able to do that. And for the students that have been displaced, as I'm sure you've heard, some of them have been, the majority went to Egypt. 15% of the students went to Egypt, but nearly half of them are clinical students, year 4 to 6, which require clinical placements, but they're not able to get clinical placements in Egypt. So they had to be displaced again to either Turkey, South Africa, Norway, and there's a big group, hopefully will be going to Pakistan in the near future.
Thank you very much, Professor Mahmoud. Before I open the floor to listen to your comments and questions, I have two more speakers, and I'll come to you, Dr. Omar Lattouf, last to ask for a brief comment. But before that, I'd like to move to Dr. Ibrahim Bouaram. He is a lecturer of global health at Queen Margaret University, and he was part of the health sector governance and finance for early recovery and transition workshops. Please give him a welcome. The situation in Gaza is tragic and exceptional, which might call for different modalities of funding. How have you discussed this topic?
I think we discussed it just because it might be contradicting what we call it an early recovery and a transition, because we thought even on the second day and for at least a few years, we need still a consistent humanitarian funding still channeled into Gaza. So it cannot be just starting to think, I would say, about universal health coverage without really meeting the immediate needs of communities. And so in other terms, there is a responsibility and a commitment that should be done from donors to ensure that, at least in the first few years, there is a continuation of the humanitarian funding, and then introducing the cash and voucher assistance to communities while your other elements and other building blocks of this system are in place, like improvement in service delivery and other aspects.
Since the occupation is not allowing cash into Gaza, how do you deal with this?
I think there should be an element of advocacy, and if it's not just about cash. I think some colleagues in our group discussed the inability for international actors to work with local implementers, and this should change, because local implementers know the system better than anyone else, and even if any international NGO would like to support them, they cannot support them because of this exact challenge.
Can I ask one more quick question? Now, if there's a shortage of supply, this is basic economics, and you send cash, if you manage, prices go up, people don't get necessarily more supplies. Have you thought about this?
We haven't, and my colleagues, we haven't thought about it from that perspective, and that's why I said it's not in the first few years.
Right, I see.
And again, Gaza, similarly to other settings, you have disrupted economies now at the beginning. So we're not talking about it maybe immediately, but this is what we should be aiming for on the long term.
Very good. What did you discuss on governance?
Governance, I think, and I know we don't have time to go into the details, I think the key message was that we should have a locally owned process. It should be Palestinian-led. And it's not just a principle that we write it everywhere. And we had a concrete example of the polio vaccination campaign, which showed that people, they have the knowledge. We don't want to teach them how to do things. They just need the resources, and they can do it. And I have a long list of examples, whether the surveillance system, the central lab in Gaza, whether the family medicine model that is even better than other places in the region. And I have a committee for accepting donation and not kind of throwing everything in Gaza after the war, et cetera, et cetera. So they have the know-how. Dr. Ghada, our colleague from UNRWA, mentioned that they lost it, but I'm quite confident that they didn't lose the knowledge to how to redo it. It should be done by them.
Highlighting Palestinian initiative and ownership. Thank you very much for your contribution and being so aware of the time. Please give all the speakers a hand before I return to... I'll have a brief question for Professor Omar Lattouf, co-founder of GHI as well as chair of GHI, and then I'll open the floor for your comments and questions. Professor Lattouf, you'll be delivering one of the concluding speeches. Nonetheless, I'd like to ask you this question. Very concretely and pragmatically speaking, what are the useful things that you've heard that GHI can immediately use?
Well, on the healthcare educational issues, I want to follow up and commend and congratulate Professor Lubani for the work that he is doing, where he has created a functional system to enable medical students to continue their enrollment and to graduate. And as we're informed today, actually some of the students that he is supervising will graduate on time from universities in Gaza. For that, I will congratulate Professor Lubani. And I will follow up on what Dr. Lubani has alluded to briefly, our support to universities in Gaza and to ensure that those universities do not fall out and do not fail, because saving universities is of grand importance. The value of saving universities will be appreciated in 10 years, 20 years, 50 years, 100 years from now.
Right.
And to that issue, at the American University of Beirut conference in June of this year, under the invitation of the president of the university, Professor Fadl Khouri, who's represented today by Martin Najm. And I want to acknowledge many of the people who participated in that seminal meeting to create an international health education alliance. I want to recognize Professor Intizar Hussain, Professor Muhammad Latif. Certainly I want to recognize Martin Najm, who was principal in making that happen. His Excellency Dr. Mustafa Barghouti, Professor Muhammad Zaman, and certainly I want to recognize the value that Professor Hani Khouri contributed today, and Dr. Irene de Vries. So our objective is to expand the network of global universities who are committed to support, endorse, sustain, and enhance those universities. And in addition to the ones that I have mentioned today, University of Geneva is participating with us. Boston University, represented by Professor Zaman, is participating with us. In Jordan, Al Yarmouk University, the University of Jordan, Al Balqa University, Al Hashimiyya University, and more to come. Our focus is to ensure that universities, which are the brain trust of nations, do not fall out and that they are sustained. Thank you.
Thank you, Professor. Now I turn to you for a brief interactive Q&A session, and I kindly ask that you keep your questions and comments short and concise in the interest of having as many of you participate as we can. There are, if I'm not mistaken, runners in the room with microphones. There they are. They are ready, and they will be where you are if you raise your hand to contribute. So whoever has a question or comment, raise your hand, please. Right, excellent. There is one in the back. Thank you for breaking the ice. What's your name? Who do you represent?
Dr. Isra Ziada, and I represent Strasis, which is a healthcare advisory firm in the UK. I'm also a Palestinian British doctor. Just on the point that Dr. Latouf has articulately put together in terms of investing in the future of Gaza, I would just like to just go back to the initial Gaza Healthcare Conference where Professor Sultan Barakat, who, like many others in this room, has been involved in every Gaza reconstruction, he said something that was really quite striking, in that his research showed that the biggest catalyst for reconstruction post-conflict is investing in the higher education of the local population. Just the question to the panel, in your experience, in your different lenses, how key is this investment right now in this context of the ongoing genocide in terms of the immediate impact, the medium impact, and the long-term impact?
Thank you very much for that very important question. Who'd like to take this one up? Dr. Lubani.
So the Gaza Educate Medics is a very expensive project. So it's, the estimated cost of it is about $300,000 a month, which is a big budget. But if you break it down, it's $150 per month per student. So although it might appear huge in the beginning, but imagine you're educating a medical student for $150 a month, which is not that much. Actually, compared to what they used to pay before the war, it is a lot less than it used to cost. This is causing problems for us, for example, because we have to deliver the teaching program, we have to deliver the teaching in Gaza for the students. So we do need to pay faculty and educators in Gaza to pay to deliver the teaching. And we have started the project and we have funding for the first few months, but we do need to keep working hard to secure continuous funding, otherwise the project would fail. And you know, you would have to leave the students midway through their education. I don't know if anybody else could pick it up. So funding is important, funding is vital, but I'll give you an example of our project. 80% of the students are still within Gaza. Only 20% are outside of Gaza. But there's a lot more money spent on the 20% outside of Gaza to get them everywhere for their education than the students in Gaza. So we need to be aware of where we're spending the money. We need to spend it correctly. We need to spend it appropriately and in proportion to where it needs to go.
And you're, of course, underlining the vital importance of that investment. Thank you very much. And thanks for that question. More comments and questions from the room. All right, I see a hand go up there.
Thank you. Mohanna Jadal from My Right to Hear. I would like to thank everyone for making this possible. And we are just here for one objective, I guess. And it's not a question, it's just like a call to follow up after this great gathering. What we are expecting, at least in My Right to Hear, that to have a categorized roadmap for rebuilding the healthcare system in Gaza. And I just suggest to just distribute this and share it with all the organizations or the audience here to take their commitments. Because without commitment, I guess it will take longer time. So let's work from now, just after the conference. And as we said, we are one of the people or the organization who we are carry our commitment with us here. And we want to see it on the ground as soonest. So thank you so much.
Thank you very much. Dr. Fawzi, I'd like to follow up on that question. There is a lot of solidarity in the region and globally speaking. Many people wish to commit. Does that mean that we have enough resources? And if so, what do we do with it?
Well, actually, I am sure that there are so many donors, whether governmental NGOs or even people who would like to support in rebuilding Gaza. There was a conference in Kuwait just 2 months ago. $2 billion has been pledged, and everybody is waiting until there is a ceasefire. So probably one of the most important things that we should come out from this conference, we have to call for a ceasefire, and then the rebuilding will start. After this session, we will have an important session from theory to action, where you will hear about how we can rebuild Gaza. I think that is so important, but I am sure that the resources will come, but without ceasefire, you cannot do anything.
Excellent. I believe, Dr. Armo, you wanted to comment on this?
Actually, I do not have a comment, but if you allow me, I would like to exercise my role as a chair of GHI. And knowing
Do I have a choice?
many of the people who are in this audience, and I want to recognize Professor Mohammed Zaman, who is a world expert on displaced people and a world expert on public health and allied health issues. And I would like to ask him if he would take a minute or two to comment on his vision of how we can contribute to better address the needs of displaced people in this situation. Professor Mohammed Zaman?
It's indeed a topic that we didn't consider explicitly.
He's right behind you.
In a minute, Dr. Zaman.
Yes.
And thanks for joining us.
No, thank you very much.
On displaced people.
I think one of the challenges we have to recognize is that there's near permanent displacement when we're talking about people in Gaza. So some of the people who had moved to Gaza moved in 1948, right? So you're living through sort of several generations of displacement, almost a permanent sense of displacement for 74, 75 years. So that's the first thing one has to recognize, that the world didn't start on October 7th. There's a major challenge of healthcare access among these people that has to be thought of. The second thing is that anything that we rebuild, we have to recognize the global reality that there may be other, God forbid, opportunities for the other side to destroy that. So you really have to build with a sense of resilience and being able to build it again and again and again should this happen again. So we cannot sort of just be ignorant about both the history and the possibilities of future as we really rebuild some of these things. The third thing I've mentioned before as well in some of the other sessions is the value of thinking of health in a broader system. We cannot build hospitals or clinics when there are no roads. We cannot build hospitals or clinics when the water isn't available. We cannot build hospitals or clinics without sort of thinking of the broader context. So health has to be situated for displaced persons in a broader context and cannot be viewed in a silo. And I think that's something we have to keep.
System, indeed.
And beyond the health system, right? I mean, sort of the political system, the financial system,
right.
the infrastructural system. So even there's a limitation of the idea of health system that it has to touch upon a bunch of other things in terms of fundamental human rights that has to be part of that.
Thank you very much. More questions and comments from the room, please feel free to raise your hand if that's the case. All right, so we have two. Let's start with the gentleman over here and then the lady over there.
Yes, thank you very much for this great conference, and hopefully we'll reach the collaboration we are all here for. I'm Dr. Hashim Al-Hashmi from Kuwait Medical Association. So one word that was mentioned many times, we have to raise our voice to reach ceasefire. And I'm asking, where is media today from this conference? This is my question.
You mean local media to cover?
No, where is CNN, BBC, Al Jazeera?
Okay. Yep. Well, they're not here. I can't ask them.
It's part of our role, actually.
That's a very important question. Who on the panel would like to comment very briefly on this? Even though it's not the focus entirely, it is important nonetheless.
Actually, all our conferences is being covered by a lot of international media channels, but we prefer that we send them the coverage because of some of the sensitive contents. So this conference will be covered as much as we can, and we did that before in Beirut and in Amman. There was a coverage in Amman for about something more than 200 channels and the news agencies worldwide.
Right. Although your point is taken that there might be double standards in international media coverage, that of course also Her Highness the Princess touched on. I believe there was a question over there. Yes, madam.
Hi, my name is Dana Mustafa. First of all, thank you all for the discussion today. I've learned a lot, especially about the initiative that I actually didn't know about. And as a Palestinian who was born and still live in the diaspora, I'm very proud to see that we come together always, and we are always able to raise above the bar. However, one of my question was touched upon in our work discussion, which is number 3, in which my point is our main obstacle comes from the other direction. They always change the rule whenever they want. They increase the list of prohibited medications that they come to. They are allowed to enter to Gaza or to the West Bank or to whatever. I mean, Israel is above the law. And this is our main obstacle. And unless we force them to change the law, I am afraid that we will continue rebuilding Gaza. I believe the people in this room all together are smarter than Israel and their laws, because people who want to live are smarter than people who kill them or they want to die. And I really hope that we will be able to think collectively to change the reality and to make Gaza even closer to be free and to make Palestine free from the river to the sea. Thank you.
Thank you very much. Let's see if there is perhaps one final comment. There's in fact 2. Please keep your hand up if you wish to contribute at this point. Okay, so I'll take the final 2 comments, and I'll start with the gentleman on the right, from my perspective.
Thank you. Hi, my name's Andy Ferguson, representing Ideals. None of us really know what the governance structure is going to be in Gaza when eventually there is a ceasefire. But I guess we can be fairly sure that the health cluster is still going to be in place and the sub-clusters all contributing to the recovery of the health system. So my question for the panel is, how is all the expertise garnered within the Gaza Health Initiative going to input to the health cluster? How is it going to bring that expertise to bear within that coordinating system?
Right. Whom of the speakers wishes to respond to this one? Ibrahim?
Yeah, but I mean, we didn't discuss how the Gaza Health Initiative would bring the expertise, honestly, but I think one of the key points that was mentioned in my group is to differentiate a bit between the technical kind of a policy level and the political, if I may say, in a sense, because I mean, it's not the case in Gaza. In the case in Afghanistan now, what would you do? Would you keep on speaking with technical people or not, from the international community perspective, or from an organization? I'm not talking about politics here. So I think there is an opportunity maybe also to advocate for this differentiation between the political and the technical in terms of policy, because you need to work with them. And I think also in our group we highlighted the need for not just projects that fund services. You need to build capacities, governance capacities, people in the Ministry of Health or in other places to be able to support them to do their job of governance and leadership. So I think this is the best I can relate to this question, but not specifically on GHI.
If I may, I just add, when we started in Palmyra Academy, our purpose was actually postgraduate training and postgraduate programs and working with the Palestinian board to improve the standard and raise the standard to international level. And this work is still very important. Gaza and the West Bank do not need to keep having international surgeons or physicians coming to treat the patients there. They should be able to have appropriate, robust training programs within the West Bank and Gaza to produce specialists that they require. Right. And this is a very important thing that we needs to be looked at when things are quieter and being redeveloped, because the time for them to require visitors from outside should finish and should finish soon.
Thank you very much. Dr. Mustafa al-Barghouthi.
Thank you. Two very quick comments. First of all, yes, I do agree that we are smarter than the other side, for sure, and nicer as well. But, but that's not enough. We need to be more organized. Their strength is in organization. And the more we are organized, the more we're capable of doing things. That's a very important point. The second point about the issue of whom to work with, what will be the situation in the next day. For Netanyahu, there is no next day. For Netanyahu, it is today, and it is keeping occupation. So let that be clear. These guys want to keep the occupation of Gaza, and we have to prevent them from doing so. But we should not allow, I mean, there are so many other parties who are trying to design for us what will be our future and what system will be there. Americans, Israelis, etc., etc., etc. No, that's not acceptable. I think we as Palestinians have agreed on a very good agreement which was signed in Beijing, which spoke about forming a national consensus government, which would end the internal Palestinian division, hopefully, and will allow for Palestinians to decide their future. And so it would be Palestinians who will decide how Gaza would look like. And no other party from outside the world, from the world outside, will decide for us. Thank you so much.
Thank you very much. In the interest of time, I'll add one more person on the list. Yes, sir, over there. But please, in 30 seconds, if you could. And I apologize for the time management. Yes.
Thank you for giving me the chance to participate in this session. Actually, all of us knows that the resources are very limited in Gaza. And these very limited resources has higher value than before. But my question is, do we utilize these limited resources in the right way? I mean that I see from my experience that still there is a potential to utilize what has existed in Gaza in a very better way. Thank you.
Thank you very much. Very important point. Last 30 seconds for the room.
Hi, Serena Cruz with Global Surgery Umbrella. Just looking into this moment, one of the important things that's happening because of the resistance that the Gazan people, the Palestinian people are keeping up with allies around the world, is that it's changing the tone of the term occupation. Occupation is now a reanimated, sensitive political term. And there are a lot of occupations around the world still. So what I would encourage the leadership here is to link with that term occupation in an emancipatory manner. Because within the Global South, that's where the future is. Thank you.
Thank you very much. I'll take just one comment from the panel on the issue of using the supplies that are available as efficiently as possible. Did any of the workshops consider that issue? We actually have a workshop that considered supporting, that considered supplies, so maybe from that one. So,
I distracted him.
That's fine. So the issue of using the supplies that are made available somehow as efficiently as possible, has any of the workshops considered that? What are some of the methodologies?
Well, actually, you mentioned that we will make an interactive platform, which already started, that we can prioritize what are the most urgent needs because of the limited resources. So now this platform will be in direct communication and coordination with the people on the ground. So they will decide what are their priorities. This is why we can send the most essential needs for the health sector in Gaza.
Excellent.
Yeah.
As they return to their seats in the room, please join me in thanking the reporters. Thank you very much. We'll now have our final panel session. The title of the session is From Theory to Action, Translating Recommendations into Implementation. And I'm very happy to pass on the task of moderation to Senior Advisor on Health Systems Strengthening here at KIT, Dr. Pierre Pratley, standing here next to me. And the co-moderator is medical doctor and advisor at KIT, Irene de Vries. There she is. Irene, please come forward. Give her an applause. And the floor is yours, Pierre and Irene.
Thank you very much. As the panel kind of takes their seats, I want to welcome you all on behalf, of course, of all the organizers, KIT, GHI, Her Excellency, and we are actually going to go now from theory to practice in this session. So what we're going to do is really take all the different inputs that have been made, the discussions from the breakout sessions, as well as the reporting out we just did, and we're going to pull it all together with this phenomenal, may I say, panel of experts. I'll get to the different panel composition in a second, because we actually have some breaking news from Gaza. We just received, about 15 minutes ago, a video from the Deputy Minister of Health in Gaza, and he wants to address the conference, so we're going to cut over to the video for 1 minute. He also is going to speak to the theme of this panel, with your permission. And then we are going to go into 3 rounds. One first round, each panelist gets a question, 3 minutes to answer. We have, of course, done a little prep, so we're trying to hit on the key points here. Then second round, where we actually have a couple of questions where the panel together in a dynamic manner can respond. Once again, the format of 3 minutes per question round. And then we actually will go to you for your contributions. Now, there are reporters here, and we are recording, we are writing down the outcomes, because Mayada will speak to this later. We're really trying to pull together the outcomes of the conference. So before we go into the first round of panel, and with your permission, I propose that we cut to the video of Dr. Abu Arish, who is the Deputy Minister of Health in Gaza, and who will speak as well to the topic and the subject matter of this panel, moving from theory to practice. Thank you.
Bismillah, alhamdulillah, wa salatu wassalam ala rasulillah. First of all, I would like to extend my sincere thanks and appreciation to all of you and to everyone who contributed to the success of this conference. I'd also like to extend my sincere thanks and appreciation to all those working in the health sector in Gaza, symbols of humanitarian work, who have persisted in carrying out their mission despite the killing machine, despite the targeting, despite the destruction of hospitals, primary healthcare centers, and despite attacking the ambulance system, and despite preventing medical supplies, disrupting treatment abroad, and reducing the work of medical delegations. They face multiple challenges, including tens of thousands of casualties and common diseases, in addition to communicable diseases. Today, as I speak to you, there are 6 new cases consistent with the symptoms of polio. Those tests are pending in addition to thousands of cases of gastroenteritis, skin diseases, meningitis, and other diseases in an environment suitable for their spread, where people push, where people are crowded together in inhuman conditions. As for the title of this axis related to moving from theory to action, I would like to point out that the most important decision that everyone should focus on is to stop the aggression and this genocide, as it's not possible to move towards real intervention, and it's not possible to move from theory to action while the machine of destruction and genocide is still ongoing. I'll address the necessary intervention in 2 matters. The first is organizing, rationalizing, and activating the ongoing response to the health emergency situation. And the second is developing a plan and strategy for the expected recovery phase. As for the first point, it's organizing, rationalizing, and activating the response to the emergency situation, which aims to provide the basic and possible health services and try to mitigate the effects of this disaster. To achieve a better response to the emergency situation, I'd like to emphasize the following. The Ministry of Health has developed a plan in which it has identified the priorities of the required interventions and their areas, and it was widely spread. We emphasize not supporting a parallel health system and to strengthen the existing health system in its governmental and non-governmental branches. The importance of finding mechanisms for coordination and effective partnership between the various partners. Focus on local and national staff in setting priorities and necessary interventions. The second point is to develop a recovery plan to be ready for implementation once this genocide stops. This plan begins by developing mechanisms to evaluate the health system in terms of infrastructure, human resources, and supply chain, and mechanisms for selecting priorities accordingly, developing an intervention plan, ensuring coordination and partnership, and developing health indicators and building a health information system, and creating a monitoring and follow-up system. The recovery phase will go through 3 sub-phases. The first one is to restart the remaining health facilities and to start the process of evaluating the health system and the damage it has suffered. Actually, at this phase, even we can handle the health facilities which is partially damaged and it's needed just a minor intervention. And the second phase is the rehabilitation phase, which is focusing on the remaining of the health facilities, which is in need for major rehabilitation to restart. And the third phase, which is the rebuilding or reforming the health system, as this will depend on the areas of population distribution, replanning of the different governorate, and the presence of infrastructure and all of the elements which is needed to the health system. Until that time, unfortunately, we'll not be able to go to the recovery phase, and we'll focus just on the first phase, which is responding to the emergency situation, and to focus on how we can provide the very essential needs and the very essential services for the people under this very critical situation, and how we can empower and support the already existing system, and not to go for a parallel system which can unfortunately even make the already existing system more fragile and easy to be collapsed. Until that time, we'll continue to pray to save lives. We continue to do our best. We continue to do what can be achieved under this very critical situation. Finally, I would like to thank you for your attention. Wassalamu alaikum wa rahmatullahi wa barakatuh.
I think really, really powerful but also humbling words. We chose to really make sure that we could depict the video that literally just came in because of its relevance. As you can see, these are the straight messages from the field, from Gaza, from the Deputy Minister of Health. And I know already from our prep that many of the points, and I saw the reaction already in the panel, he's touching upon are really relevant and are going to be made now. Just to make sure that you know who's sitting here on the other side, who will also be asking questions, we sort of do a relay thing, is Dr. Irene de Vries. Is my colleague in the health systems team as well. She's a senior maternal health advisor, and she'll be taking the questions to the different panel members. As I said, one by one, we'll go through these. So to kick it off, I wanted to go to our first panelist, the esteemed Dr. Mai, the former Minister of Health in Palestine, in fact. Many, many years of policy-making experience, many years of experience in the field and in dealing with running and supporting and strengthening a system that is under constant pressure. Any insights? What are your key insights thinking of this moving from theory to practice, and also reflecting on the message we just had from Gaza? I saw you taking a couple of notes as well. Would you please want to start with your 3-minute comments and recommendations?
Thank you very much. And also very important about what we heard from Gaza, because they are in the field, and we salute them for their resilience in Gaza. To all our colleagues there, whether they are medical doctors, nurses, or any others. Respecting also their vision, because they are on the ground, they are those who are suffering, and they are in their own eyes and their own efforts, they are doing what they have planned. And happy to hear that they have a plan and it was distributed. So as you said, first of all, I do agree with what he said and what others have said since this morning. Number one, we should call for an immediate ceasefire, because if the ceasefire is not occurring, so we cannot do our job correctly. Under the destruction, the bombardment, and all these issues, it's enough that they are just surviving and trying to help and have emergency services. So number one is immediate ceasefire. And I hope that we can call for international community from this, and by the end of this conference, to have an announcement for ceasefire. Immediate ceasefire would be great. Number two, I think that we need to have a plan prepared, taking into consideration exactly, and with priority number one, what he said, the Deputy Minister, and to look into their plan so we can aggregate what we are seeing. In addition, that this plan should be a comprehensive plan, not only in health but in other issues, as somebody I think Mr. Muhammad Zaman said that health is in the center for us as health professionals, and surrounding us all the other issues as education and other issues. So we need a comprehensive plan using the plan that was prepared by the Ministry of Health, as well the plan or the roadmap that the World Bank has presented this morning. It is very good one that we adopt as a roadmap with this plan and with recommendations that have been just mentioned from the workshops of this conference. Together, a small committee of experts, they go and they prioritize using all these tools so we can reach to priorities, and then this plan will be done by those professionals and expertise in having a plan, but detailed plan, so we know from this plan who's going to do what, and giving the slides for this health sector, this NGO or the government or whatever. So this is very important, accompanied with donors. The plan which will have also the donors, and this plan will give the donors also enough space that they will think that I can donate for this project, I can donate for the other project. Number 3, also we need a really coordinating body. I'm finishing. We need a coordinating body that really is very important, especially in Palestine. And this coordinating body, it should involve the Ministry of Health. It should involve the NGOs, the international NGOs, experts, and UNRWA, of course, Red Crescent Association, and all the stakeholders, whether they are local or international, and international NGOs, as I said, with the Ministry of Health, so they as an umbrella, so they can go ahead for executing this plan. Thank you. I'm looking for the time. We have the health cluster as an example during when I was minister, and I think it's going on, that this cluster was headed by the Minister of Health. And still, I think, because Dr. Mustafa just told me that they did one meeting of this, headed by the Minister of Health and the WHO co-chairing as technical assistant, and the ambassador of Italy, because Italy, until now, is the shepherd funder of the European Union. So these 3 are chairing. And we used to invite the Minister of Health from Gaza. They were with us on Zoom, of course, unfortunately, and also the UNRWA and all the international UN agencies related to health, their representatives, and the local NGOs, because they are our own stakeholders, as well the international NGOs. And we were agreeing for a national health plan that is still going on. And from this national plan, what we are going to do with landmarks every 3 months. And every 3 months we were having a meeting, evaluating what we have done, and looking forward for the other 3 months what we are going to do. And out of this health cluster, there is subcommittees, and these subcommittees for NCDs, for maternal health, etc., and for mental health, etc. We can do something for emergency.
Yes,
I don't want to have more
no,
time,
but you will have more time to
yes,
to
I
give
wanted
your
to put as an example. Thank you very much.
Yes, thank you very much.
Thank you so much.
Yes, you can give her an applause, of course. Of course. Thank you. Okay. Our next panelist is Dr. Mohammed Shaheen. Welcome. Mr. Shaheen holds a doctorate degree in public health, and he currently serves as the Dean of College of Graduate Studies and Scientific Research at Dar al-Kalima University in Bethlehem. Mr. Shaheen, as a public health academic, you are familiar with systemic and holistic approaches. Today's conference had a health system framework, and that fitted very well with the introductions that we had from the WHO and the World Bank. Can you tell us something on how you have experienced this approach and why you think this is important?
Well, thank you very much for inviting me here, and
I have been inspired by many presentations and many interventions during also the breakout sessions. Actually, nothing really left to us to say about the holistic approach. Just I wanted to reiterate something here, that Palestinians have been engaged in the holistic approach because of the situation that we are in. Dr. Mustafa is here. We have the medical relief committees. We have many other committees and organizations that are working on the ground, and they are integrating the work of health and medical services and also the community services in general. So we realize in public health that health system is only a determinant of health, and it only contributes around 10% of the health of the population. And that's why it's important to integrate it into the economic, social, and cultural priorities and needs and context so that it can be really effective. So the recommendation here, the practical recommendation here is we need to establish committees that are intersectoral, not only medical or health, because when we talk about health, you talk about food security, you have to talk about sanitary conditions, environmental degradation, and psychological, psychosocial challenges. So all of these together, of course, with the impact of occupation as a political determinant, we cannot think of health as a medical condition. We need to really integrate it into different sectors, and we need to establish committees that are really working together from different sectors. The other I would say, issue that was repeated, in the breakout sessions is coordination. I think Dr. May, Dr. Mustafa, and many others addressed this issue by saying that we need really to strengthen the ability of the Palestinians to really control the resources and also govern themselves. We cannot rely always on donors. We need to have a balance between the donors' power and also the local power. So we need to have empowering the voices and the ability of the local governance to really be able to decide on their own, and donors and others should really support their priorities. So we need to also think of establishing a coordinating committee, not only the health sector level, but also at the political level between Gaza and the West Bank, because we cannot continue working separately. This would also impact on our health and also wastage of our resources. So these are some of the highlights that I would say are really critical to the holistic approach working. I mean, working with communities like mental health. And during the Intifada, we had 1/3 of the population had PTSD, although now the Palestinians have changed the terminology. It's CTSD, continuous stress, post-stress disorder. So it's not really a post-trauma, because we're continuously confronted and exposed to trauma, and large scale. We cannot afford having psychiatrists and clinical psychologists because we don't have them. And we should not actually focus on that really thinking. So we need to also adopt this ecological model in interventions, where we have done school-based intervention and community-based intervention in the psychosocial support. Like in Gaza, everybody is impacted, including even the West Bank now. So we cannot afford the clinical model in addressing our needs and priorities.
Thank you so much. Very sharp insights as well here on the holistic approach, on the multi-sectorality of health, of course, and engagement of other sectors. as well as on mental health, a major continuous issue. Our next panelist is Dr. Hamid El Ayad. He is a civil engineer. He holds a PhD in civil engineering as well. And he's been at the University of Maryland and has over 37 years of experience working as a consultant engineer. Some of your key work recently has been as a founder and member of the board of directors of the Arab and International Organization to construct in Palestine. And some of that key work has been around doing an inventory and assessment on basically the infrastructure, the assessment of damages of the health sector, and also to think about putting that down in a working paper that you have been working on with colleagues on the role of the authority in rebuilding the health sector in the Gaza Strip. So you can hear the expertise and the work that has been done of Dr. Ayad really focuses on the infrastructure and the key question of infrastructure. So what are some of the key points you want to give along when we think about moving from theory to practice of the role of infrastructure and all this intersectionality for the rebuilding the health sector and the health system? And any thoughts on how it could be governed? In 3 minutes, please.
Thank you, and it's my pleasure to be here, and thanks for GHI and KIT that held this conference. Actually, the Arab and International Organization to Construct in Palestine, IUCP, established in 2009. So we have been on the ground for 15 years doing projects, and we after the first war in 2008, in 2012, 14, and 21. The strong point for our organization that we have expert people, engineers on the ground. We have more than 35 permanent engineers on the ground doing projects for these 15 years. We did many projects. That the time is limited, so I don't want to talk about the previous projects. I just want to say that we are looking for the health sector, maybe from different point of view. We are looking, maybe using wide zoom camera, that the health sector is not only treatment of patients in the hospitals and providing medicine, which is important thing, but before that, it's like entire system, complete system together. So we started, and after after October 7th, maybe in the second month, we started like distributing drinking water, as maybe Dr. Barouthi said in the morning. It's important to provide drinking water for the people in order to to prevent disease. Also providing 5 hospitals with desalination units in order also for the hospitals to provide water that's suitable to be used for equipments also. Removal of solid waste from the streets, and we remove about 20,000 tons, but out of about 400,000 tons. And it's cost about maybe $400,000. Rehabilitation of many parts of the hospitals. We have 7 projects now. Some of them started, some of them will be started soon. In Al Ahli Hospital, in Al-Shifa Hospital, the lab and blood bank building, the kidney and chest building, the physical therapy department and sterilization department. Also in Al Ahli Hospital, we have also in Nasser Medical Center, in addition to Abasan Medical Center. So all these, some of them already started, some of them will be started soon. But also we make rehabilitation for many bakers, about 10 bakers, in order to provide like bread for people. But now we have a big challenge. that before the winter season, we have to fix or make maintenance for the drinking water network and sewage network and storm water network. Why? Because when the rain is coming, of course, it's polluted because most of sewage network is distracted and broken. So the water will come and will enter to the water network, which also is broken. So before the winter season, we have to fix this. If there's like a big maybe area that we cannot fix, even at least we have to close it in order not the sewage water to enter and the drinking water, because this will make a catastrophe, because we'll not be able to fix it another time. So this is one of our challenges. Sheikh Radwan Pond, maybe in the media, most of them heard about it. This pond should be like emptying and pumping from the pond itself to the sea, because we have no other solution. There's 2 points. The first thing is how to fix the line, the pipes from the pond to the sea. And we are lucky. Yesterday we get permission to enter pipes. Then we have to manage to have pumps and work to emptying this pond.
Thank you.
Thank you.
Yes, thank you, Mr. Alayed.
to-
Thank you very much. Please, another applause. Okay, we have not gone through all our panelists yet. Our next star is Jennifer Davies from USUR, a long-term partner organization of kids. So Jennifer has a background in pharmacy and a master's degree in public health from Birzeit University. And at USUR, she is senior monitoring and evaluation manager and currently responsible to monitor all emergency and non-emergency projects in the organization. Welcome, Jennifer. The conference has brought together a very wide range of voices to unite knowledge and resources to drive change. As a Palestinian NGO with a brand in Gaza, you are dealing with the day-to-day operations. What is needed, according to you, to ensure local engagement, alignment, and maximize impact on the ground?
Thank you, Irene. First of all, before the timer starts, please, I would like to extend my deepest gratitude to everybody sitting here for your unwavering support to rebuilding Gaza. And I'm speaking today on behalf of Dr. Umayya, who couldn't be here today due to visa issues. He's the director of Jazur, who has been leading efforts boldly and shifting Jazur's mission to directly provide services in Gaza during these unprecedented times. And of course, this wouldn't have been possible without the dedication and commitment of every team member in Jazur, in the West Bank and in Gaza. So thank you, everybody. To ensure local engagement and impact on the ground, I echo what everybody has been saying about the need to stop the genocide. And this will enable us all to be mobilized and to work more towards Gaza. We need to consider and think about all the phases, like Dr. May has said about the immediate phase, the recovery phase, and rebuilding Gaza. We need to strengthen community partnerships. We need to move forward and empower Palestinian organizations to respond effectively to evolving situations. We need to look into local NGOs, which are deeply rooted into Gaza's realities. And they are key in delivering interventions that are effective and relevant and sustainable. International NGOs, international organizations should continue their interventions, but with a commitment to partnering with and supporting local Palestinian organizations. While they may have more freedom of movement at the moment, their role should complement and not replace the leadership of local organizations in coordination with the Palestinian Ministry of Health. We should invest in the capacities that are in Gaza and we should build these capacities. We should look more into the social determinants of health, like Jazur is doing, and work more on what's really impacting the society. We should adopt a community-centric approach, where we need to listen actively to women, to youth, and to marginalized groups in making our decisions. And we should look and trust them and to empower them into what we need to see in the future. Of course, we've talked a lot about networking and coordinations, and our stance is more about developing plans, like Dr. May and many of you have said. We need more strategies, we need more plans to look into the future. And we believe that with a partner like Gaza Health Initiative, we believe that they could be a supporting body to this initiative, and we could work and coordinate together with all other clusters and organizations within Gaza and the West Bank. We need to develop a lot of more evidence, and we have evidence-based interventions, and we believe that a partner like KIT can be invaluable. With their invaluable support, we can provide a lot of evidence and support. We also need to look and leverage of local resources and knowledge. I mean, if we're looking all around today, we can see so many experts sitting around. And with their harness, let's harness their wisdom and experience and create solutions that are both effective and sustainable. We need to think about building back better. We need to look at the situation right now. We must build better back. Instead of restoring what was lost, we should rethink the entire healthcare system. It's about restructuring and reimagining a system that serves the needs of Gaza today and in the future. The only way forward for Gaza's health system is to develop a resilient model that fits its unique context. My last sentence is that our path forward requires courage, selflessness, solidarity, and relentless commitment to building a better future for all Palestinians. So let us all work together to make this vision a reality. And thank you.
That deserves an applause. Yeah.
Thank you very much. I look at the reactions around me, the panelists, a lot of nodding. Perhaps you want to hand your notes to our note takers, because it was quite a comprehensive list, so we make sure we can cover all of this reporting out. I was feeling bad for the note takers there for a minute. And you sort of kept it within time as well, so fantastic, Jennifer, thank you. Our last panelist, last but not least, is Pim Kraan. Pim Kraan is the CEO of Save the Children, the Netherlands, an organization you will all know, I'm sure. And he's been a CEO since 2014. He also is a member of Save the Children International Management Committee and bears specific responsibilities for guiding the humanitarian team and Save the Children Europe. Many hats. He's a founding father of the Dutch Relief Alliance, which is a unique collaboration between 14 Dutch-based international NGOs, providing dignified aid to communities in 13 countries, and that is funded by the Ministry of Foreign Affairs. Pim, welcome.
Thank you.
Just switching over to sort of your expertise and area of expertise. In the opening sessions of today, we had a presentation on the conflict recovery framework that was presented by our colleague from the bank, also with support from WHO. Can you tell us something on how, as an international NGO, you operate in these kinds of frameworks? What are the applications, and what are the sort of ways in which you guys integrate some of these insights from the framework in your work, for example, in Gaza? In 3 minutes, please.
With pleasure. But before I answer your question, I would like to really go to the topic of going from theory to action. And I would like to thank you, Your Royal Highness, Princess Dina, for your words. You spoke your soul this morning and your heart, and it came straight to my heart. I think the restoration of the rights-based order, and dignity is the prerogative for anything we're going to do after this. The theory is in the law, and the law is not being upheld. I think it's our duty as INGOs to use our network to stand up for the people of Palestine and to make an ending to the suffering. It's hard to stomach the stories that come from our teams, to see on the news what's being done and the double standards that are being applied, including in the Netherlands. So thank you very much. That was for me the highlight of the day, your speech. And I think that in a reconstruction framework, most of the ingredients have been already shared. I think basically you can refer to your notes, locally owned. The restoration of dignity also means the restoration of governance. It's basically allowing the Palestinian people to determine their future and design the healthcare for their people. So INGOs are often in this kind of frameworks a bit in an odd position where they have too much power over money. They're actually not the specialist of reconstruction. We've said that time after time. So it's our duty to step aside, locally owned, locally designed, locally implemented, and that we offer our services, network and advice when applicable and wanted to come to a situation in which we can indeed offer appropriate healthcare to the Palestinian people. I think that from the Netherlands we have specialism in mental health. We can maybe assist there. And I would like to point out that I think that we should also include education, because children need structure, and we need the structure to reach the children to be able to cope with the stress and continuous stress syndromes they have. So I'll leave you 52 seconds. Thank you.
Pim, thank you so much for these thoughtful remarks. Very, very insightful. I'm a little bit looking around here because I'm looking at the time. We had envisioned sort of a small extra round of questions first and then going to Q&A. But perhaps with some permission, perhaps we can go to the Q&A for this session, kind of use that for the reporting out as well, also with permission from the panel. And then we still have a couple of remarks towards closing so that we can, manage the time a little bit. I don't think we will lose a lot on the content because a lot has been said already, and we will make sure that we cover, of course, the rest. So the opportunity here now is for the room, for you as an audience, and also if at all, any insights from online are also welcome. Questions for the panelists regarding this topic, theory to action, and all the subject matter that we've covered today. And particularly, we do quite some education here as well. It would be great to hear from people who haven't spoken before as well. So I do encourage those people as well to come up, and I think there's a first person already over there. So perhaps we can kick it off. We'll take, I'd say, a round of up to 3 questions, and then we can go through the panel and maybe cycle back one more time. Let's go. Room mic, please.
Hello? There we go, okay. Thank you very much for taking this question, and thank you for the panel. Maybe a bit of a controversial one. First off, my name is Samir. I'm a Palestinian medical student at the University of Leuven, the Catholic University of Leuven in Belgium. We've been encamping in the Catholic University of Leuven for the past 4 months. Today's actually the anniversary of the beginning of our encampment there, putting pressure on them to break their ties with Israeli universities. And my question is actually more so a question about something that I feel has been missing from this conference and possibly from the GHI in general. And it's about the language of initiative to achieve the ceasefire and more ideally liberation for Palestine. More specifically, I've been frustrated at how often we've heard repeated that we must wait for ceasefire before we can truly apply this plan that we are creating, with which obviously I don't want to take away from the amazing effort of organizing that this assembly has done to better coordinate the rebuilding of Gaza and what different agencies have done to currently bring aid into Gaza and for our medical colleagues there. I merely mean to ask, what political, social weight are we throwing at helping Gazans and Palestinians achieve the ever necessary ceasefire and ideally liberation? For instance, couldn't the GHI publicly endorse BDS against Teva, a well-known Zionist pharmaceutical company, or that we write a statement in which we endorse what students all over the world are doing when they rally against their universities' collaborations with Zionist universities, many of which are in the medical field and are often cited to whitewash these collaborations with Zionist universities that we all know materially and ideologically support the genocide of our people. Thank you.
Thank you.
Are there more questions from the room?
We have some volunteers going around with mics.
Good afternoon. I'm Martine Najm from the Faculty of Health Sciences at the American University of Beirut. Thank you all. This has been a very insightful day, and particularly this session. I want to take this opportunity to commend the increased weight of public health in this panel and the value added of the discussion, talking about a comprehensive approach addressing social and political determinants of health and all of that. And I think if we want to extrapolate this into other sessions, we should try adopting an as much holistic approach to the sessions on workforce development earlier, on funding, on capacity building. I'm saying this because we tend to undermine the role that maybe ordinary Gazans are playing in this response, or other public health professionals, or other professionals in general.
Can we go to the question, please?
Yes, we focus a little bit too much on medical students, which are important, on physicians and all of that. But I think the integration of new respondents, people who are contributing to the response and who will contribute later, is important. So maybe we can talk a little bit, and I'd like to hear from esteemed panelists on how we can integrate those other human resources, whether it's community-based health workers, people who are not specialized in medicine nor public health, but who are doing
the point is clear.
Medical and public health
Thank you.
work. Thank you.
Very important point. I'm sure that the panelists will have a couple of things to say about that.
We can take a final question, I think, before we see many hands. Yes, there in the back. Yeah, usually it's.
Please, straight to the question. The preamble is it has been. We had the time for the preamble today.
I'll do one preamble, and that's a call to action to the room. And that is to be braver than you are, because you are braver than you are. And that each space that you enter is political, and that you can call for political actions from your leaders, from your colleagues, and from your institutions. And that is very, very, very much necessary. And justice is on our side, and the goodwill of the people of the world is standing behind Palestine. And many people are here today as well. So my question was about how do we unite these forces, and how do we unite ourselves after having here so much people willing to help, and there are much more people willing to help only from my institutions. So how do we go on from after this initiative?
Thank you for the concise question. So, with your permission, because I think more than 3 will also lead to some falling off, is that okay? Does anybody from the panel want to make a remark based on the 3 questions that were fielded just now?
I think, thank you for the questions on how principled we are and whether we're making enough noise. Definitely not, because the war is still raging on. But I would like to share with you that Dutch civil society indeed is coming together like never before around this war. We have been teaming up from day one to address the government and demand, for instance, the withdrawal of the evacuation orders. I sent an urgent letter to the Minister of Foreign Affairs on the 13th of October, and we have been biting in her tail ever since. So four times have been in Prime Minister Mark Rutte's office with my colleagues of the Dutch Relief Alliance, and one time with Médecins Sans Frontières, to demand the ceasefire support, to address the complicitness of the Dutch government into to the acts of genocide that were being committed in Gaza. We have the Court of Justice in our backyard, and the rulings and the instructions of the court apply to all parties to that convention, and that includes the Netherlands, and we don't think that the Netherlands did a job well done. We rally worldwide. We've been beaming the Berlaymont building of the European Commission in a guerrilla action to demand ceasefire already in October. We have been drumming on pots and pans to disturb the Council of Government on Friday morning to demand justice for the children of Gaza that were starving, and on and on. And on the 12th of next month, we will be rallying here in Amsterdam again. I invite you to join us on the Dam from 2 o'clock in the afternoon to 3 o'clock in the afternoon. We are not going to let them get away with it. Thank you.
I wanted to respond to the second question on building the capacities of allied health professionals. All organizations, local organizations in Gaza are using these people. We are utilizing community health workers, we're utilizing volunteers and youth groups to we're building their capacities on responding to emergencies. Midwives have been trained to do emergency deliveries in shelters. Community health workers have been raising awareness on health issues in shelters and in everywhere possible in Gaza. So yes, I do believe in a public health approach, and I do believe in addressing all social determinants of health, because these are the core issues that need to be addressed at the moment during this emergency situation. So I hope I responded, and Dr.
Well, thank you for the question. I think this is an important one. But I have to tell you that in Palestine, we have, like she said, we have the village health workers program. So we train them. They are really community people coming from the villages that they serve. And also we have a master program for mental health that are engaging not only medical people, but also coming from different backgrounds. So we're spreading also the role of the school-based program that we also implemented in the West Bank. We involved, it's the ecological model, the service providers who are serving the children and youth who are also impacted by the traumatic experience of the occupation and the incursions of the Israeli military incursions in the West Bank. And also we have involved the teachers, training them in also supporting children in psychosocial support, and also understanding why children sometimes they are really behaving in a weird way, as they call it. It was a very, very helpful program that also we involved parents as well. So all the ecology of the community is involved, and this is really effective. And I think Palestinians can provide really good models on engaging the community and the holistic approach in public health.
Thank you for the questions. I think that for ceasefire, yes, the international community has the responsibility to use all measures to stop the bombardment and the atrocities on Gaza. It's 10 months and the genocide is continuing, and all the statistics that we have seen, although I don't believe in that the human being is number as one of the NGOs outside, as children are not numbers. It's true, because we are people as any other people. However, ceasefire should cease immediately, and the most, the earliest possible, so the people, number one, can be relieved. Number two, these initiatives, not only ours, but also there are other initiatives as infrastructure and other issues, can be started in, at least the earliest possible. Therefore, the international community, they assume the responsibility that they should oblige Israel for ceasefire, and it's too late now to continue talking about this issue. To tell you the truth, I am a human being. I'm ashamed of humanity in this concrete moment, because what's going on in Gaza is shame on humanity in the century 21. Regarding the comprehensive approach, I do add my voice to my colleagues. I don't want to consume more timing. And also, we need to have dialogues internally as Palestinians and with the NGOs, so we can have a comprehensive plan, and by that also comprehensive approach. Thank you very much.
No, that's okay. Okay, we have been told it's time to start going to the last round, and I think it's very important that we make also some final statements. We have been talking here today about the nexus of humanitarian aid and development. We are here together with a lot of humanitarian workers, donors, people who want to act, people that want to take their responsibility, and with this great variety of people with policymaker hats, NGO hats, public health hats. Can you please give us your final statement on what you want to say to this audience here today, but also the audience that is listening or that is going to read on our report backs? What is your main message in this whole context?
Please, Dr. Ahmed Al-Hayat.
Okay, thank you. Actually, what I want to say at the end of this session, that united together we can do a lot. I think we need coordination. We need to unite our efforts in order to be able to help our people in Gaza. And before I'm finalizing, just let me thank our offices in different countries for the IOCP, that they are funding our projects, and mainly the Jordan Engineers Association. My colleague, engineer Ahmed Samar Azobi is here. He's in addition to the Morocco's people from Algeria and from different countries, they are funding our projects. So without their help, we cannot do what we already did, and this is continue for next projects and others and so on. So thank you for their effort. Thank you.
Thank you.
Well, just to say my message is you cannot be really healthy unless you are free. So our health is really our freedom, is being free from occupation and control of the foreign colonial project of the Zionists. And Palestinians are capable of becoming much better and healthier without occupation. So Palestinians are capable, they have the human resources, they have the skills, and we don't need to be dependent on others. We need to be free. Thank you.
I just wanted to portray one message about listening from the ground. Listen to young people. Listen to healthcare providers in Gaza, because they are experiencing everything firsthand. Thank you.
I would like to thank KIT Institution and salute all GHI co-chairs and advisory board and all its volunteers and all those who are here and who are listening to us through Zoom for this important day for rebuilding the health system in Gaza. And my message is more resilient in Gaza and more solidarity for our children and our civilian societies in Gaza. We as Palestinians, we are resilient, rooted deeply in our land, and we refuse to be uprooted from our land because we are the people who were living there since eternity, and we will continue to live until eternity. Therefore, the international community should question the Zionist system who are with its atrocities committing genocide against us as Palestinians, not only in Gaza, but they started also in the West Bank. Thank you.
Thank you, Dr. Mai. Pim, any last words?
I think that if we stop arguing whether a child has the right to live, as is stated in Article 6 of the UN Convention for the Rights of the Child, then we are, again, humans. And if we stand shoulder to shoulder, we can move mountains, and I would say let's do it.
Thank you, Pim, for these inspirational words. Thank you so much to the whole panel. Give them a great applause. Thank you for your participation. We're going to go to closing now, key remarks and bringing everything together. So please stay with us. Thank the panelists one more time, and let's go to the closing of the plenary.
Let's also thank Pierre and Irene for their excellent moderation. Thank you very much. That's mine. So we have come to the closing session. Please bear with us a little more. And I would like to invite to the floor the head of the Palestinian mission to the Netherlands, His Excellency Ambassador Ammar Hijazi. Please welcome him.
Thank you. Thank you very much, I'm honored to be with you today in my first official event as Palestine's ambassador to the Netherlands. It's certainly an honor to be with a group of people who have dedicated their time, effort to save partly humanity, but also to help and aid the Palestinian people in this very dark hour of our history. I'm honored also to present Palestine today in this very important event, as everybody did in a very proud and honorable way. As you know, we meet close to the end of an entire year of genocide and collective international failure to stop it. It has been an agonizing, collectively traumatizing, and soul-crushing 11 months. What our people have endured and continue to endure is simply unthinkable. The level of depravity and cruelty meted out against the Palestinian people, especially in Gaza, is without a doubt the darkest chapter in human history. Not just because the unprecedented level of destruction and criminal assault on our children, hospitals, and all other foundations of our life, not just because of the shocking normalization of genocide and genocidal statements and actions by Israeli officials and their supporters, not even because of the astounding level of complicity of some states, companies, and organizations. It is such a dark hour in human history because we humans claim to know better and be committed to higher standards that would ensure genocide never happens again. Israel's genocidal war in Gaza exposed the built-in weaknesses, holes, double standards, and outright hypocrisy of the international system. This genocide has also highlighted unmatched courage of selflessness of Palestinian doctors and medical workers and their international colleagues. Our heroes wear scrubs and white coats. They work under humanly impossible and cruel conditions, which I know you have discussed at length today. But allow me to take a moment to recognize and express our gratitude and the equally heroic doctors around the world who continue to volunteer their time and expertise to serve alongside doctors in Gaza despite the risks, and then spare no effort to speak up on behalf of the victims and health workers and humanitarian workers as well in Gaza. This brings me back to the invaluable significance of the Gaza Health Initiative and all other partners, including KICT Institute, the American University, and everybody who have participated in this initiative. You represent the best in humanity, the noble, the honorable pursuit of providing proper health care to those who need it most and those fighting to survive every minute of the day. And very importantly, you are not allowing some of the international community to treat the overwhelming needs in Gaza as simply humanitarian. You are dealing with the Palestinians as humans, and you are dealing with the Palestinian people as people who are entitled to rights as they should be treated. The health system in Gaza is crushed because world leaders and international system failed them and the Palestinian people for so long. They have failed them utterly and completely. Most strategically, they have shown that the system does not work universally. This must terrify us all, without exception. But that's why your work is also so inspiring. You are showing the cynical and complicit that there is a different, far more supreme and humane way to confront adversity and inhumanity. Constructive, active solidarity that rejects exceptionalism, aggression, and colonial aggression as well. Israel's crimes against the Palestinian people and healthcare system span the entirety of the occupied Palestinian territory, including in East Jerusalem. They are not an exception. They are standard policy and have been going on for years that has been normalized by international inaction. So it's not enough to provide Gaza and the rest of the occupied territory with humanitarian assistance. This doesn't get countries off the hook. They must end the root causes for why these catastrophic tragedies repeat, for why the Palestinian people have been stripped of their humanity and human rights for over 100 years now. They must end Israel's illegal colonial occupation of Palestinian land and its entrenched impunity. Hand in hand with important initiatives like yours, Palestine believes that we must continue to pursue accountability tirelessly and aggressively. We will not stop knocking on all doors of international accountability mechanisms, including the ICC and the ICJ at The Hague, but also the UN General Assembly and the Security Council and every other international mechanism. We will not spare the international community the discomfort of having to accept a simple fact. Either this system works for everyone or it works for no one. Those obstructing justice, threatening blackmailing, and arm twisting must understand that they will bear the responsibility of bringing the whole world order down if they insist on shielding Israel and Israeli officials from accountability and sidelining the Palestinian rights. Palestine will not back down. We cannot, because we cannot let the bullies win. Everyone loses. That is historic burden and responsibility we shoulder today. I'm sorry for taking so long, but let me conclude by doing an ultimate Palestinian thing, pointing out reasons for hope during this dark hour. My friends, the pain we feel is crushing. The disappointments are demoralizing, and the justified anger is almost overwhelming. But we must also take a moment to honor the undeniable outcome of our collective and cumulative actions. We are at the cusp of a new reality where the pro-peace and pro-justice voices cannot be shut down or ignored. They are shaking the foundations of an unjust world that for too long got away with everything. No more. And this is not one issue victory. Standing up for humanity and against genocide is standing up for humanity, for human rights, for human dignity, and for the fundamentally different future. Take a moment to recognize and celebrate that we have earned it. Thank you for your work, for your courage, and for your sacrifice.
Your Excellency, thank you very much for joining us, making the time, and for your words. We now move to the final two speeches, and the first is by Professor of Surgery and co-founder, as well as chair of the Gaza Health Initiative. You all know him, Dr. Omar Latouf.
Mr. Ambassador, thank you very much for your words. They are not falling on deaf ears. Allow me first to congratulate my colleague, Dr. Fawzi Hammouri, the executive chair of GHI, for being named as one of the top 100 healthcare leaders in the Middle East and North Africa. I'm often asked, why do I do this? Why do my colleagues in GHI do this? And I have tried repeatedly to articulate a meaningful response, a convincing answer. But I actually found the answers last night at the reception and today at a meeting. Last night, a doctor from the UK, a Dr. Muhammad Tahir, who left his orthopedic practice in the UK to volunteer, and he shared with us video clips of him arriving in Gaza with lollipops in his hand, and children clamoring around him, asking for the lollipops and singing. Then he showed us a follow-up video of him leaving after finishing his task, where those children coming and hugging him. And as he saw that video, he teared and cried and said, I do not know whether those children are alive today or not. And today, we had a session with Professor from Gaza, from Al-Quds University, Professor Bassam Abu Hamad. And he is teaching from a tent in Gaza. 11 months into this war, he's still teaching with a smile on his face. How could we not be inspired by these people? They are the ones who encourage us, who promote us, who make us come to work, and who give us another breath of life to pursue the humanitarian work that we all are doing collectively. In the last several hours, we have heard a lot about the death, destruction, and demolition of Gaza's health care. Yes, it is our responsibility to remember that with the destruction of healthcare, there are 2 million plus people who need those healthcare services, and without it, their future is very awesomely negative. So please keep them in your mind, and let's together work on how we can find solutions and continue to find solutions. It has become very evident that the ongoing destruction and unrelenting death machine in Gaza is continuing. And I have heard repeatedly today, and many times before, that let's call for a ceasefire. I regret to tell you that I am not calling for a ceasefire, because I do not have the wishful thinking that a ceasefire is coming. There is no ceasefire coming. We need to be forward-thinking, that we have not reached the pinnacle of disaster. We're still barely halfway through. My fear is that the West Bank is following Gaza. My fear is that southern Lebanon may be following Gaza. And I am worried about Jordan and what's going to happen to Jordan. And I'm worried about Syria and what's happening to Syria. If we do not plan to build our resources and increase our capacity to address the injured and the likely increased number of injured people, then we are putting our heads in the sand. Mark my word, there will not be a ceasefire anytime soon, because those powers that are fueling the ongoing war have not decided to agree for a ceasefire. Let us be realistic and let's prepare and increase the capacity for humanitarian need. Let's train more doctors and nurses so that they can care for the injured and the wounded. Let's prepare for more hospitals that need to be going in to treat the injured and the needy. One focus that I have, and I value my colleagues who are addressing the needs to continue the support of medical students and nursing students and dental allied health workers in their pursuit of education so that they can graduate. I appeal to you to look on a strategic standpoint, that we must support the institutions. We must ensure that those universities and the hospitals that belong to those universities to train the healthcare workers must survive. We've seen pictures that came today, which destroys Al-Azhar University, Al-Quds University, Islamic University. Somehow we must support those universities not to go into default. The loss of those universities means the loss of the future of the people of Palestine and Gaza. And God forbid if what is happening in Gaza today marches into the West Bank, and those universities in the West Bank are destroyed, then the future will be very gloomy. We must make every effort to unite academic institutions around the globe so that they can support their sister institutions in Palestine and beyond. I hope that together we can work and we can support Gaza, we can support the West Bank, we can support southern Lebanon, and we can support all those areas that are going through the painful experiences that they're going today. I cannot thank you enough, each and every one of you, because each and every one of you is a leader. You inspire me to work, and I value your contribution. Thank you.
Thank you very much, Professor. And I salute you and your colleagues in the Gaza Health Initiative and beyond for the effort you're making. Our final speaker, and then I take the floor for 30 seconds and then you're off, is the Managing Director of KIT, the Royal Tropical Institute of the Netherlands, Mayada Az-Zohri. Please welcome her.
All right, I know everyone is tired. It's been an incredible day. It's been a humbling day for me. It's been intense and emotional. I think all of us are feeling a lot of feelings. There's so much work to do, and I think that became obvious from everything that we heard today. There is so much more to be done to support the Palestinian people with the health care that they deserve. And despite all the carnage that we've seen, the footage that we saw, despite sometimes feeling helpless, I am completely inspired by everyone in this room and all the people that we heard from today, the organizations that have been working tirelessly to support the healthcare system in Gaza and the West Bank. Despite those who are working against, those who are creating systemic destruction and those who are creating a political stalemate. But I have to say that being here today just has been incredibly inspiring. I think other people have mentioned that. I do have faith in humanity. I think it was Dr. Mai who was saying that she's ashamed of humanity, but the people in this room actually give me faith in humanity. When I watch the news, I feel very depressed. However, starting from last night, when we got together in the room, all of these organizations, I felt incredibly inspired. I felt hope for the first time, personally. So I really want to thank all of you for everything that you've been doing. I do hope that you also feel that there is something very powerful in the unification, in the uniting together, all of us in this room. And I do want to acknowledge the work of GHI, because that is really, truly what you are doing as an organization, is that each of these organizations have been working in an isolated way. And what GHI has done is it has gathered them together. And there is enormous power in us gathering. And I, for one, feel that I have more tools today than I did yesterday. And I have been networking and talking to various organizations about what we are going to do tomorrow with the information that we've gained today, how we are going to mobilize and do more to put pressure on our governments, to put pressure on the international organizations that do have the resources, that do have the power. I think all of us are more equipped. So for KIT, we are completely honored to host everyone here. This building, I'm sure you've noticed, it is a historic building. It is a symbolic building. It is a symbolic building of colonialism itself. So it's interesting that we are all here to actually talk about the destruction and the elimination of colonialism, because that's essentially what we're all working towards. I just want to also acknowledge all the phenomenal speakers that have inspired us today. We started with Lina in the morning. Lina Shadid, she did an incredible job representing GHI. Dr. Baruti, you're incredible, really inspiring speaker. Her Royal Highness Princess Dina, amazing, as always, just really incredible. And of course, this is my first time to meet the Ambassador Hijazi, wonderful speech, and of course all the others as well who have presented throughout the day. Some of you are probably wondering, why did KIT host this event? So I want to give you a little bit of just reference or background. So I moved here in January. So I'm new to the Netherlands myself. I'm an Egyptian, but I used to live in Washington, D.C., in the US. And when I came, of course, it's 2 months after the war began, I really could feel a certain energy among the staff, this sense of we need to do something. A group of gathered and said, let's create a Gaza response. Let's do something. And then as we were trying to figure out what do we do, we came upon GHI. And we saw that GHI was doing, it's just a group of individuals who are all incredibly phenomenal themselves. They come from different organizations, but they just mobilized this initiative, I call kind of the private initiative, the private sector. And we saw this momentum. We sent someone to attend the Amman conference, and we saw the huge potential that they had to mobilize so many of the private individuals who wanted to do something. And we felt at KIT that we sit in this unique space. We sit both with the private actors, but we're also very much connected to the international aid architecture world. We work with WHO, we work with the World Bank. We are implementing with many international NGOs. We're partners with all of the big aid architecture. And so we felt that there was something that we could do, our organization could do, to bridge this world, to bridge the private, incredible power that organizations like GHI could mobilize with the structures, the power holders. And we felt like bringing these two worlds together can help us direct resources to the organizations and the people that are actually doing the real work. So I have to say that I feel very gratified today that our ambition of trying to broker this world I think we could have done better. We can always do better. I am disappointed. I have to be very honest. I'm very disappointed we didn't have more donors in the room. We talked to all of them. And some of them are here, but not many. So it is disappointing that there's still fear. But I'm nonetheless very proud of what we've been able to achieve together, and I know that we will do a lot more. So this event has really exceeded my expectations. There have been so many messages and takeaways. We will produce a synthesis report. We will produce some kind of roadmap. There will be a video that documents the event as well. I heard so many takeaways, but the one takeaway that really is sticking with me, and it has a lot more to do with KIT and our role, is this advocacy role. Because as internationals, as people who are not in Gaza, as organizations that are not delivering services on the ground, we must use the power that we have to influence the decision makers, the power holders. So that's the one big takeaway that I have. So my last job is to just thank all the tremendous people. And the first people that I want to thank is, of course, my team at KIT. I would like you to stand up. Irina, Pierre, Harry, I don't know where Harry is, Chantal Lakis in the back, and Bipasha. So truly and honestly, and I do not say this lightly, I cannot imagine a better group of people to work with. So thank you. They are incredibly committed, creative, positive, inspirational, everything. There's many, many more people at KIT that I want to thank, but of course the list is too long. You saw them all over the event, I hope. I also want to thank ANIRA, the only organization that helped sponsor this event. So huge thanks to ANIRA. Sean Carroll, the CEO, was unable to be here, but Sandra Rashid is representing him, so thank you, Sandra, for joining. I want to thank the GHI, the advisory group for this event. Of course, Dr. Fauzi, Dr. Latouf, Lina Shadid, but I also want to thank two other members of the advisory group that were really, really instrumental in helping us identify speakers and helping us shape the agenda. And they are Umayya Hamash from Jazur and Dr. Yusuf Abu Rish from the Ministry of Health, who you saw on the video. So you've been ushered, the mics have come to you miraculously, and that is because we've also had a group of tremendous volunteers from the International Federation of Medical Students Association and also former KIT alumni, either students or staff. So I want to thank them as well. And so before I hand it back to Ali to do the very, very final thank you, I do want to please ask you to join tonight. This has been an intense day, and I think we do need some laughter. And as you saw, Maysoon has that ability to make us all laugh, so I hope you do join. And yes, if you haven't bought tickets, there's still a chance to buy them. There is the QR code, and you can access it on the way out. So thank you all so very much, and I hope you do enjoy dinner before I see you at the evening event tonight. Thank you so much.
Another big thank you to Mayada and her team. Thank you very much. I must say that, in spite that we could do much more, but we are in Amsterdam. Don't forget that. We did a great job. Thank you very much, everybody. I want to invite you all, Princess Dina, we want to take a group picture. Everybody, please, join us.
Let's wait for just 1 second.
1 second.
Because I'm instructed to make one more announcement.
Please.
My apologies, Dr. Fauzi. So The QR code for your ticket is right there, and I promise to tell you where the money collected will go to, and that's for the education of Palestinian medical students. So, and the performance will consist first of a very exceptional Palestinian oud player. I've had the pleasure of listening to his virtuos playing very often, so you will enjoy that. Subsequently, it will be Maysoon, the comedian and actress, and then there'll be a Dabka class, I believe. Allow me to quickly thank everyone for their presence and participation. Her Highness Princess Dina, Dr. Mustafa Barghouthi, Ambassador Ammar Hijazi, Dr. Fawzi and Dr. Latouf, as well as everyone else at the Gaza Health Initiative, the team at KIT, the speakers and moderators. Thank you very much, and I salute you and your efforts one more time. Thanks. And now let's have, thank you. And now let's have, before we leave the room, the group picture. How do you want to do this, Dr. Fawzi?
Like somebody down, somebody up.
On the stage, everyone?
Here and down. So like we have 2 lines.
Okay, this requires coordination. Okay, so an executive decision has been taken. Please head all immediately, before you do anything else, to the front of the building, so the main axis. And wait for us there 1 minute, and the photographer will arrive. We won't keep you in the cold too long. Thank you very much. Yeah, it's yours, I know.